This is a rapid appliance case that we just received from one of our Chrome doctors, Dr. Glenn Goldstein. And the rapid appliance is a duplicate pickup completed at the surgery. So the doctor picked up one long-term prosthetic, which the patient's going to wear home. But before Chrome is removed from the mouth, the rapid appliance is then picked up on a second set of temporary cylinders. Now, this occurred about 4 months ago, and now Dr. Goldstein is going to final. And so he removes the patient's long-term prosthetic from the mouth, puts some tray adhesive on the bottom of this rapid appliance, seats it, equilibrates it, takes a bite registration, and then performs a reline impression to give us the new tissue. And with this information, we have implant position, soft tissue, a complete prosthetic that the patient's been wearing for the last 4 months, a duplicate of it, picked up. We have a bite. We have an opposing. And with this information, we can go either to a printed try-in prototype, or we can go directly to final, especially on lowers, directly to final. So that means patient comes in one appointment, take the records, and the last appointment, seat a final restoration, the rapid appliance.